Hey, everybody, and welcome to July's episode of Cancer Prevention and Wellness. I'm your host, Jeff Jagir. And what we try to do with these sessions is look at various ways in which we can live with a diagnosis of cancer, whether you're in the throes of the actual cancer diagnosis and treatment, or whether you've kind of kicked it to the side of the road, or whether you're dealing with some kind of loss of a loved one. There are ways to move forward and live your best life. So we try to do that each month in this series. Tonight, we have with us Stephanie Hoops, who is a oncology certified nurse, a Bachelor of Science in Nursing, and a accredited nurse navigator at the Center of Integrative Oncology and Survivorship at the Cancer Institute of Prisma. Stephanie has been with us before, and she always does a good job. But tonight we're going to talk about safe integrative medicine techniques. And there's a lot of science behind this. Stephanie will share some of that science. There's a lot of accrediting bodies that look at the data and determine if something that sounds like a good idea is actually a good idea and improves versus nothing or a placebo. This is a category of medicine that is known to have good ideas and good ideas for techniques, but they haven't really withstood the rigor of scientific testing. And if they haven't done that, they may not be harmful to you other than the fact that you may be paying for them and it's no real benefit to you. But there are some that potentially are harmful and we want you to avoid those. So without further ado, I'm going to have Stephanie share her presentation with us. And my first question to Stephanie, as always, is how is your garden grow?
Thank you so much, Dr. Jagir. My garden is growing well. The weeds are growing just as well too right now, especially with the humidity.
And what do we
So
have going in it now?
potatoes, corn, beans, tomatoes. The rabbits, this sounds so real, but the rabbits got all my carrots. So, and I've got some
Well,
herbs and flowers. My
yeah.
lilies did really good this year. So
Okay, great. So you got a beautiful garden and some edible stuff too.
absolutely. So let me pull up the presentation. Sorry about that. So this is going to be on integrative oncology and options. So I'm going to spend the next few minutes with you going through going through our what is integrative oncology. I'm going to reference the Society for Integrative Oncology and their guidelines. They came out with some recommendations for and a grading system for integrative options. So I'll go over that, and then we'll talk a little bit about other integrative therapies and the safe use of it, and we can pull it all together at the end.
And so for those of you that are regular listeners, a lot of this will be repetitive, but it's good to review periodically. And for those that are new to us, welcome. And I'm glad you're here. But this will serve as a primer for the kind of integrative, complementary, holistic therapies that we're trying to help our clinicians with. And they appreciate that.
Yeah, and absolutely. And just remember, this is integrative therapies. If you're looking to hear me say that frankincense and essential oil is going to cure your cancer, they're in the wrong presentation. So, but we will talk a little bit about different therapies and what they are recommended for. So I've got this. This is SIO's, the Society for Integrative Oncology's definition of integrative oncology. And it's a little wordy, but it's a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. And please note that alongside conventional cancer treatments. Integrative oncology aims to optimize your health, your quality of life, and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So I really enjoy like that little circle up there where it has your conventional cancer care and your complementary care, as well as self-care. I was a holistic nurse, and self-care was one of our key scopes of practice, where we couldn't be holistic nurses if we weren't taking care of ourselves as well.
And the other part of the cancer continuum that I think complementary care integrative therapy can help with is prevention. So
Absolutely.
especially if you have a cancer diagnosis in your family, potentially you're genetically predisposed, there are certainly techniques here that will decrease the risk of that genotype, that is what's in your DNA, actually expressing itself as a phenotype in your life. So
Absolutely. And we do a lot of prevention over here at CIOS and our sister department, the Center for Cancer Prevention and Wellness. We have a whole breast cancer prevention clinic, and we do a lot of genetic management for patients who don't have cancer, but do have those genetic markers. So, and to get into those three topics, the first one they talked about was the mind-body practices, and these are the ones that work for, calming your mind, but also include body manipulation and things like your yoga. Not only is it exercise, but it also is sort of a meditative process. Things to just help your mind and relaxation, like guided imagery. We also talk about Tai Chi as part of a movement therapy that also includes breathing and controlled breathing. So it becomes, again, another meditative process. Acupuncture falls underneath these mind-body practices, massage therapy, music therapy. So all of these are sort of a combination between your mind and your body.
and we just had a lecture on music therapy last month, and very impressive what she was able to accomplish with her patients.
Absolutely. So, music therapy can range from just listening to music because you enjoy the songs, it gives you energy, or actually going through a certified massage or music therapist who does have that outcome of and goals that they set for their sessions.
So Stephanie, massage therapy, I mean,
Mhm.
if I go get a massage, I might feel better. Is there a difference between a therapeutic massage and a regular massage? Are there certified massage therapists that are trying to do something more than loosen up the muscles and that?
Oh, yeah. So there's different types of massages. So when you're talking about therapeutic massages, or you're looking for, a massage to work out a muscle, so you might want to do those deeper massages. But we also have certified oncology massage. So they have a special education that knows about oncology patients, and they're able to look a little bit beyond. Does that patient have lymphedema because of lymph nodes removed? Do they have maybe a bony met that they would have to metastatic cancer in their bones that they would have to watch out for? And then, of course, we also have the lymphatic massage, which helps lymphedema. So there are different types of massage therapists. You might want, having a cancer, you may want to seek out an oncology certified massage therapist. And then we want to talk about natural products. And, there's so many natural products out there on the market. There's herbs and plants that people use, even just your simple kitchen herbs. There's probiotics. I mean, I went shopping for a probiotic, and there's literally just an aisle of probiotics. So it's really overwhelming. vitamins and minerals, and then also your supplements, you could sort of get lost in those aisles. It could range from just using a simple herb like ginger for nausea, or drinking some ginger tea, all the way to probiotics for gut health. But again, when we're talking a lot about these natural products, there's usually a cost. A lot of them are very expensive when you look at some of the higher end probiotics. And then also, these are regulated. There's not a whole commissioning body that certifies each of them as safe to use. So one of the things I don't have on here would be diet. Diet is a natural product when you're talking about eating a whole food diet and plant-based.
So one of the things a probiotic does is it alters the bacterial makeup of your microbiome, which you certainly can do with fiber. And it used to be that different fruits and vegetables had seasons, but now with logistics and refrigeration and all the ways that fruits can be grown year round and show up in your grocery store. So some of the ones that you consider for adding fiber to your diet would be the raspberries and the blackberries and
which
avocados.
are in season right now.
Right. And so they don't necessarily have to be imported right now, but avocados, obviously we don't grow those around here, but they come up from Mexico, lima beans, lots of vegetables that have a great deal of fiber. So the best way to alter your microbiome is with the diet, as Stephanie mentioned.
Absolutely, which comes to the next slide, which is lifestyle modifications. So these are things that are in your control. We talk about, when you get that diagnosis of cancer, there are things that you can't control. You can't control your age or your gender or anything like that, but your diet, you can control what you're putting in your body. You can control how much movement and activity you have. You can sometimes regulate your sleep. I think sleep has been a big issue for a lot of people, but getting quality sleep is important within treatment or even just prevention. Stress management, how do you manage your stress? Are you one of those people who have an overwhelming amount of stress and can't manage it all, or do you have a good mechanism where you can handle that? And then, of course, limiting harmful habits, things like smoking, limiting your alcohol consumption, things that are actually harmful to you.
And you're right, we can't necessarily alter the quality of our sleep, but we can certainly do things to give us enough time to actually sleep. And that is going to bed at a certain time, waking up at a certain time, 7 to 8 hours a night. Sleep hygiene, a kind of a routine before you go to bed, and
Limit your screen time before bed.
limit the screen time, right? Because
Yep.
that blue light is not good for the melatonin in your body.
And earplugs sometimes if you have a lot of noise, or sometimes just background noise. There's a lot of different apps that'll give you some background noise to help you sleep. And I look at these lifestyle modifications, and they're very, very similar. Some of the things that we follow along the lines are from the American College of Lifestyle Medicine. And they have 6 some foci of health, and most of them are increase your physical activity, manage your stress, improve your sleep, avoid risky substances, helpful eating, and one other thing that's not on this list that you're looking at is maintain and form healthy relationships, which some people overlook, that the support systems that you have around you, making sure that you have healthy support systems. So, and this is another sort of diagram of the same things that we were just talking about: the eating well, moving more, managing your stress, your love and your support. This actually comes from Cancer Choices. There's a website, and it's at the end. They do a lot of science-informed resources to help you make those decisions, to help incorporate integrative therapies within conventional treatment. So I got a lot of information from them as well.
So we're not saying you have to, be a marathon athlete and eat nothing but vegetables and flaxseed and get 9 hours of sleep and never have a glass of beer or anything like that. But we can all do somewhat better every day than what we're doing now. And I think it really starts with diet and exercise.
Absolutely. And I think I like this one because moving more makes a lot of people think about just moving and activity as opposed to exercise. I think there are some people who are allergic to exercise, but when you talk about increasing your activity and just moving, you're incorporating an exercise factor, but you're not thinking that it's exercise. So, but like you said, those little steps will all add up to a larger goal. So now I'm just going to go into, I talked a little bit about the Society for Integrative Oncology and their guidelines. So I do want to stress this report came out and it was with breast cancer treatment. Or so this was the population that they talked about these therapies and the symptoms. And the clinical question was what integrative therapies could be supplemented with and with their treatment to prevent and treat and manage the symptoms or the side effects of cancer treatment. And so they have different symptoms like anxiety and stress reduction, depression and your mood, fatigue. The underlying ones are the ones that we're going to focus in on because those are the ones that have the highest grades for integrative therapies. So, but their symptoms are among the top 5, side effects that people do get when they're going through any sort of cancer treatment. Fatigue is the big one. Anxiety and stress, chemotherapy-induced nausea and vomiting, which is that CINV. So those are things that our patients are dealing with. And so now we actually have some recommendations for those different symptoms. So let me go through just briefly, the SIO has grades A, B, C, D, and H. So we are focusing on grades A and B, and grade A is a high certainty that the benefit of the therapy is going to be substantial. So they said they've done the evidence and they've done the lit reviews and they've said this integrative therapy is going to be beneficial for this symptom. Grade B is high certainty that the benefit is moderate, and moderate certainty that the benefit is substantial. So it's a step below, but it's still going to give you some benefit. Grade C will be that the benefit is extremely small. Grade D is moderate to certain that there's no benefit from it. And then if you ever see a grade H for any integrative therapies, you probably should run away from it because that means it's probably going to harm you as opposed to help. Sorry, I needed a little water. But I also wanted to just review on this, notice there's no documented alternative therapy here. This is all integrative therapies. So they do not have any research that there is an alternative therapy that helps treat cancer effectively. So our next one is our category A recommendations. So they found that for the symptom of depression and mood, things like meditation, relaxation, and yoga actually help depression and encourage a better mood, along with, so that's going to help. And you'll notice that a lot of these repeat for different ones. So meditation is going to be your big one. It's for depression and mood, it's for quality of life. And then as you can see down here in the category B, we also have it for anxiety and stress reduction. So, and meditation doesn't just have to be one of those, I'm going to sit quietly in the corner and not think about anything, it's a practice. You start small, just like with anything else. And there's also different types of meditation. So you have mindfulness meditation, you can have walking meditations. So anything that sort of just focuses your mind onto one thing. So, and yoga has been proved for a lot of different things. Um, and most people think yoga is also just getting tied up in knots, which it's not. We have our cancer survivors doing yoga through the cancer support community calendar that we put out, and it is specific for cancer survivors. And relaxation, I don't think we've ever really been taught. We don't get taught how to relax. Everybody, we live in a very hustle bustle life, and lots of people just don't know how to take that step to turn off that stressors and just relax and be in the moment.
Yeah, some people are better at that than others.
But again, it's a practice,
Yeah, no, you can
it's,
probably get better at it.
you do get better at it. I was there once before, I know. Um, Dropping down to quality of life and physical functioning, meditation helps with that as well. Meditation also helps with, is a category B recommendation for anxiety and stress reduction. So here's where your music therapy comes in. Music therapy has 2 indications as a category B grade, one for anxiety and one for depression and mood. And then we talked a little bit more about yoga as well. Music therapy, like you said, last month's
Yes,
presentation was on
yes,
music
it was.
therapy.
Yep, yep.
It's a grade B recommendation for your depression and or mood. So fatigue, we've got a couple of things. This one says energy conservation counseling. So those are things that nurses, when we talk about with our patients, when they have fatigue, we talk about, do your activity of daily living when you first wake up and you have the most exercise. Take a nap in the afternoon if energy, excuse me. Take a nap in the afternoon when you need it. So just how to conserve energy when you are feeling that fatigue. But also there's exercise in there too. We know that exercise does combat a lot of our treatment related fatigue as well. And then I talked a little bit, I told you about the chemotherapy-induced nausea and vomiting, which is CINV. You'll see that a lot. They do find that acupressure and what they call electroacupuncture, which is basically acupuncture that has a little electrode, is a category B recommendation for that. But that needs to be done by a acupuncturist or somebody who is licensed as an acupuncturist.
Stephanie, you may not have looked at this, but I'm interested in the category H. Do you have any examples of what they have delineated as something harmful?
So you know what? I do not have anything right on me right now. So
But that is clearly a category that SIO does look at, and obviously it's something that we want our patients to avoid.
absolutely. And I think,
Toxicity
yeah, and I
with
think
buying stuff.
there's some things on our next slide that I can talk a little bit about that's either been debunked or probably not the best thing you can do for your symptom management. And then this was just what about things like essential oils? And we talked a little bit about supplements and other medical modalities. So now I wanted to put this in. So this is from the National Center for Complementary and Integrative Health, which is a department of the NIH, the National Institutes of Health. And this sort of breaks down some of the types of integrative therapies and the categories of integrative therapies. Again, we have nutritional, your herbs, your vitamins, your supplement, your probiotics. But again, diet if you have a well-rounded diet, if you are eating whole foods, shopping around the perimeter of the grocery store, so you're not buying a whole lot of the processed foods, and with added sugars, you're getting enough fruits and vegetables in, you're getting your recommendations of protein. There's very little need to actually need a whole lot of supplements on top of that. You should be getting your food or your nutritional benefits from your diet. That's the goal. You can see where they do psychological therapies, mindfulness, your spirituality, which is a big thing, and therapies. And then you have your physical, which is your manual therapies, things like massage, exercise, even hot and cold, especially when we're talking just about, muscle aches and things like that. And then they have a combination of the psychological and physical, things like acupuncture, movement like Tai Chi, and there's your yoga again. I sort of underlined all of the therapies that were recommended by SIO. And then they also talk about whole medicine systems. This TCM is traditional Chinese medicine. That's where you have a lot of your acupuncturists, but they also include Chinese herbs, the Ayurvedic, homeopathy, which is on here. So that's actually been a little bit debunked, where it used to be a little bit more well known, but they have debunked that whole theory of homeopathy at this point. And when I talk about naturopathic, there are naturopathic doctors, but in South Carolina, we don't recognize naturopathic doctors. So that's not something that we would normally refer you to.
So Stephanie, I'd like to delve a little bit into the spirituality, which we clearly think is a good thing, and it is not the equivalent of an organized religion.
Absolutely not.
Maybe it's the belief in a higher power. Maybe you just get overwhelmed by looking up at the night sky and saying, "How is that in fact possible?" That we are a small part of the universe, and how does that all happen and whatnot. So I think spirituality just implies that you're not necessarily reading the Bible or the Quran or any. I mean, there's nothing wrong with that, and I think a lot of people get their strength in that regard. But if you're just believing in something above and beyond yourself that's helping you, I think that's kind of what we're going for there.
I absolutely agree. I think it's just being part of something that's bigger than us. So, and whether that's a religion that you worship and you meet community wise, or whether, like you said, that's sitting outside looking at the stars, or one of my favorite things to do, especially in June and July, is fireflies or lightning bugs, as they're called down here, apparently. I have a whole field and it just sparkles with fireflies. And that is one of the most relaxing and wonderful things for me. So, and it leaves me in awe because it's bigger than me. So, all right. And then I've also brought in the American Cancer Society here. They have a list of therapies that are considered safe. These are a little bit different than SIO. And again, I turned around, I underlined the ones that we had read were grade A's and B's. So your acupressure, your acupuncture, meditation, but I put in walking meditation there. And that could include, so that's a part of like mindfulness, where you are actually being very intentional with your steps. You're feeling what your body is doing as you're walking. You're paying attention to your surroundings. So that's more like a walking meditation, bringing you back into just thinking about that walk. And then I decided to put in that labyrinth walking, because we do have a few labyrinths around here. And that's just a
Putting one in the
purposeful.
Cancer Survivors Park.
There you go. And that's a purposeful walk where, depending upon the labyrinth, you walk into the middle and then you walk back out. And a lot of people will sometimes be, I'll walk in, I'll leave some of my worries in here, and then I'll walk back out with leaving my worries behind with a labyrinth. I actually made a labyrinth in my backyard during COVID. So it's, you walk into the center and then you actually walk out in a different path. It was COVID friendly. You know, art therapy. Again, we talk a little bit about spirituality. We talk about music therapy. And these things you can draw. You don't have to have an instructor to say, hey, let's do some art. And art is very vast and varied. It's anything that gets your mind to be focused on one thing is helpful. So, but some of these are going to cost. Dr. Jagir talked a little bit about, you know, does it hurt? A lot of times, you know, some of these are expensive. Acupressure and acupuncture can be expensive, but they also have some licensed acupuncturists will have what's called community acupuncture, where you are sitting, you're not in a private room, you're sitting on a nice comfortable recliner, and they do a little either ear acupuncture and you're sharing that with other people. Let's see. I wanted to bring up things like essential oils. I actually had this labeled as essential oils at first, and I changed it to aromatherapy because I really wanted to focus on safe usage. So there's a lot of myths around essential oil use. As a holistic provider, we do not ingest essential oils. I think that's bad practice for anybody, but unfortunately there are a lot of people that talk about their essential oils and they recommend that. And as a healthcare professional, I would not. But if using essential oils for aromatherapy is great, but even though these are all natural and they come from nature, it doesn't necessarily mean that they're without side effects or without harm. So for example, lavender, we all know lavender is relaxing. People smell lavender and it helps with depression. But we also have learned that lavender could also have some hormone-like effects. There has been studies where it has produced some breast growth in teenage males. Is it contraindicated? Meaning you shouldn't use it at all? No, it's not. But again, we want to be using it smart. And so if you put it in a diffuser, make sure it's in a large room and you're not in a closed closet that doesn't have ventilation. You shouldn't be drinking lavender tea and putting lavender lotion on and then infusing it. That might have some other types of side effects. I've used peppermint before for nausea. I've used peppermint it's a cooling smell. So we've actually seen some people use it for hot flashes, but you need to use it with caution if you're pregnant, and it also shouldn't be used with people with high blood pressure. So you definitely want to learn a little bit more, go to somebody who knows essential oils before you start to use them. I like lemon. Lemon is one of those uplifting scents. The citrus, it gives you a little spark, you know, anything and I find it a clean scent. I guess that's come from like lemon scented dish detergent, but if you're using it on a skin or in lotion, it could cause sun sensitivity. So definitely keep learning about what you are doing. Chamomile, which some people will drink chamomile tea because it's sedative. You can infuse chamomile, but it can irritate sensitive skin. And even your ginger essential oils can be a little bit sensitive on skin and is also photosensitive. So that's why I changed that from aromatherapy or essential oils to aromatherapy. Dr. Gier and I talked a little bit before about massage therapy and the different types of massage therapies. You, I used to joke, I go for massages every month. That's my form of self-care. It helps with my back and shoulders. I like to joke I've had a longer relationship with my massage therapist than I've had with my husband. I've known her longer and I have been seeing her longer.
Does he give you massages?
He comes with me and gets massages.
Oh,
Yep, every month now it's our date night. So it's actually, healing for our
well,
relationship
that's
too.
great. Yeah.
So, but that takes a little while to get to the right massage therapist. They want to be looking for people who are taking a detailed history and physical from you, really wanting to know exactly what's going on with you. And so they can, make sure they're not hurting you in any way, or they're not doing a deep tissue massage when they shouldn't be. Like I said before, I would look for an oncology certified massage therapist in order if you are going through treatment, because they do have that extra training. Um, and then we talked a little bit about the lymphatic massage, which is a certification. Our physical therapists all have a specific LANA certification to do lymphatic massage. And that's not so much for relaxation or muscle pains or things like that. That's for the lymphedema that came from removing lymph nodes from their treatment. And I put a little healing energy in here because things like therapeutic touch and healing touch are being used in hospitals for different things. And one of the reasons why I put it in there is just to say, this isn't, it may not have been on SIO's recommendation dated list, and it doesn't have a grade, but it doesn't hurt either, because it's not contraindicated for anything. Healing touch and therapeutic touch, they are different certifications or classes that sometimes healthcare providers will do, that it's more of a relaxing session for you and that healing energy provider. With Reiki is another form where you're just laying of hands, or you don't even have to touch a person. It just helps relax a person. Most people say they don't even feel anything really happening. So that's why I sort of added the healing energy. But again, you want to make sure you start to know anybody who's doing anything with you. You want to ask them as much questions as they're asking you, and make sure that you're involved in what you want out of that session. And then we talked a little bit about the meditative movement, especially when we were just talking about labyrinth or the walking meditations. But things like yoga and Tai Chi and Qigong are all meditative movements as well, because they're encouraging you to focus in on that breath as you're doing some of these exercise movements. We have yoga through the Cancer Support Community calendar, and they have it down at the Survivors Park. And this is your sort of combination of that psychological therapy and your physical therapy. So now, how do you incorporate this, and how do you use these safely? We talked at the beginning of this is looking at what you have on hand. You don't have to buy a whole bunch of supplements or different type of herbal remedies that claim to do something. A good diet and a good balanced diet can help everything. Even with your probiotics, like Dr. Jagir said, having enough fiber helps with the flora in your gut. and keeping the good bacteria in place. Just because it's expensive doesn't mean it's going to work. There's a lot of people who think that, oh, that's so expensive, or they're spending money on these things that it's definitely going to work. And that's just not true. Unfortunately, even some providers will upcharge some of these therapies. Word of caution, if somebody is saying, oh, they can cure you of your cancer and they're charging an arm and a leg, you probably should run far away. Especially if they turn around and say, no, your medical oncologist doesn't know these therapies. Healthcare providers don't say something else doesn't work, and we're not looking at alternate therapies. Even I've mentioned the National Center for Complementary and Integrative Health. They used to be called the National Center for Complementary and Alternative Medicine, NCCAM. They took the alternative out because they realized that that's not something that we really want to be encouraging people to do. We want to use integrative therapies and combine them with our conventional care.
Thanks for emphasizing that.
Absolutely. When we talk about diet, and like I said, shop around the outside of the grocery store, you don't always have to buy the most expensive organic produce. You can buy, there's the nutrition that's put out the Dirty Dozen and the Save 16, which are the fruits and vegetables that have the least amount of pesticides in them or the most amount. So you don't have to use organic all the time. You don't have to do fresh all the time. Frozen vegetables and have their nutrients still in them. And it doesn't have to be expensive. I know there are food boxes or fresh fruits and vegetable boxes that are available for people if you want to incorporate more fruits and vegetables in. Going to a farmer's market might also be good. You're getting fresh air, you're getting exercise as you walk around, and you're buying some fresh local produce. Let's see. I would also suggest, if you are going to start incorporating an integrative option or want to do a couple of integrative options, one at a time. This way you can see how your body is working with yoga. You don't want to do yoga and massage and then train 4 or 5K. If you're having body aches, you don't know if it's from the yoga or from the training. So, one at a time, sort of keep it simple. Start with one and then go forth. Talk to your oncologist, your medical oncologist, your surgeon about, hey, I'm thinking about using this or doing this. See what they have to say. And then also the American College of Lifestyle Medicine, all of those lifestyle modifications, they have wonderful sheets and information on their website about how to incorporate all of those different types of therapies.
And you don't have to hide this from your oncology team. They respect these techniques. They appreciate you doing stuff for yourself. I mean, so much of what oncologists, radiation oncologists, medical oncologists, surgical, it's done to you. This is stuff that you can do for yourself. But as Stephanie pointed out, take your time, add things a little at a time, but your oncologist will appreciate this.
Absolutely. And, when you're changing anything in your life, set realistic goals. Exercise, you always hear you want to exercise 150 minutes a week. And, that's only 30 minutes for 5 days a week. But you know what? If you're starting from somebody who doesn't exercise at all, you are not going to get there tomorrow doing 30 minutes of exercise 5 days a week. You may have to start doing 10 minutes of exercise. And then once that's more comfortable for you, start increasing it. So I think where people sometimes get frustrated is because they set their goal too high. Bring it back, do a realistic goal, and then once you've reached that goal, you now have momentum to reach another one. So that may also include being plant-based. I want to go more plant-based. Well, you know, if you have a family of 4, not everybody in your family may want to be vegetarians. So start with a meatless Monday, do one plant-based meal a week instead of trying to do it 7 days a week. So all of those things, just making sure, you know, you are not setting yourself up for failure. You want to set yourself up for to reach your goals. These were just the resources that I've used, all of these websites, and then the article was on from the SIO about the evidence-based integrative therapies. Like I said, it was for breast cancer patients, but a lot of those are going to work across the board. And I'm going to say thank you. This is my information. If anybody wanted to reach out, I'd love to talk to them.
Stephanie, thank you so much. I am drawn to your little circle there that shows the mountains. And because nature is something you have to get out into, it's a place where people can relax. Their breathing slows down as long as they're not hiking uphill. But it's also a spiritual experience being out
Absolutely.
there. So that's why we built a park. It's 6.8 acres. There's healing gardens. There's always something flowering that's pretty and going on there. So it doesn't have to be anything that requires much effort. It can be very passive, and nature is a good thing to take in. It is very healing. So thank you. That was a great summary and a great primer and a great reminder that we are complementary to the conventional care mechanisms and the conventional care practitioners, and we work well together.
Absolutely.
And that's for the holistic care of our patients. So next month we'll have very apropos to what we talked about, a certified yoga instructor, Hannah Allen, and she's going to talk about yoga for survivors. And just like Stephanie said, it's not getting into a pretzel shape or, you know, doing what you see on magazine covers and that sort of thing. Yoga meets you where you are, and that's what she'll emphasize: various techniques and various ways to do that, to not get hurt, but to get some benefit from the experience. And that will be available probably August 8th next month. And as we normally do, we finish with a quote. And this is from Fred Rogers, or as you know him, Mr. Rogers. And it kind of talks about the need for us to slow down. I don't think we give that gift anymore, the gift of silence. I'm very concerned that our society is much more interested in information than wonder, in noise rather than silence. How do we encourage reflection? Oh my, this is a noisy world. I get up every morning at least by 5 a.m. I have a couple of hours of quiet time, reflect about what is important. What can we do to encourage people to have more quiet in their lives, more silence? Real revelation comes through silence. So Stephanie, thanks again. And to all our listeners, we'll see you next month.
Thank you very much, Dr. Jagir. Appreciate it.